Welcome to this webinar on constipation. My name's Marianne Williams and I'm a specialist gastroenterology dietitian. Today we're going to look at what causes constipation and how to prevent it. And in 2025 there were two new very important papers for guidelines on how to treat constipation. One from the British Dietetics Association and one from the World Gastroenterology Organization in global guidelines. And I will be using information from both these important papers to give you advice on what to do for constipation. So, before we go any further, I'd really like to cover the red flags area because if you're suffering with constipation, I also want to be sure that we're not missing something else that you should be going to your GP and having investigations for. So, if you've got blood in your stools or unexplained significant weight loss or unexplained low iron levels, or a sudden change in symptoms, or you're waking at night regularly with your gut symptoms, or your stools have become black in colour, or you've got bad stomach pain when you pass stools. Any of those are what we call red flags, and you should go to your GP as soon as possible and get investigations for those. So, putting that to one side, assuming you have no red flags, what is a normal bowel function? And each person is different. You do not need to have a bowel movement every day, and healthy bowel movements can vary from 3 per day to 3 per week. Stools should pass without too much effort, straining, or pain, and it's normal to have occasional periods of constipation. So, less than 3 bowel movements a week, a need to strain, and might be painful to pass, generally type 1 or 2 on this Bristol stool chart, and you've had these problems for about 3 months, then we would consider that constipation. Constipation can occur at any age, but it's much more common in women, the elderly, and those that are pregnant. The type of complications that can arise from constipation are things like hemorrhoids, so piles where you've got swollen anal tissue, fissures where you've got cracks in the skin around the anus, and bleeding from the back passage as well. Other complications can be that you could get fecal impaction, and that's where you've got a lot of stool that hasn't been passed that's backing up through the colon. And it might be associated with a loss of control with your stools, and diarrhea might appear as well. And you may think you've got diarrhea, not constipation. But in this case, it's possible to have both. You've got impacted stools, and then you've got the stools at the very top, which are liquid now dribbling down the side. Sorry, it doesn't sound very nice, does it? But that comes out down the sides of the impacted poo and ends up looking like diarrhea. The last one that I want to cover is rectal prolapse. And this is where you've had too much straining, which causes a small amount of the intestinal lining to actually push out through the rectum. And this can lead to you leaking mucus or leaking discharge that stains your underpants, and definitely needs investigation with your GP. So, what causes constipation? And what are the non-dietary causes? So, I'm a dietitian. I'm going to be talking mainly about diet, but I want to also, with constipation, cover the non-dietary causes because they are very important as well. So, number one would be not getting enough of physical activity. That's because physical activity helps the bowel to move. Too much stress and anxiety can really alter your guts and alter what your stools are like. There is a very strong link between the gut and the brain, and very much it can affect our stools. So constipation can be as a cause purely from stress and anxiety. In this day and age where a lot of us are sitting sedentary for long hours, this can also aggravate the stools and cause constipation. So, sitting or lying down for too long can result in constipation. There are certain medications that have side effects that cause constipation, and we'll have a look at those. So, things like opioids, which are used as pain medications, they can cause constipation. Some antacids, some antispasmodic drugs, which suppress the muscle spasm. So, you need that muscle spasm to help move your stools through. So, if you're suppressing that muscle spasm, your stools will not move through as efficiently. Some antidepressant drugs, some calcium channel blockers for high blood pressure and heart conditions, tranquilizers, iron supplements can also cause constipation and they can make your stools turn black as well. Anticonvulsants for epilepsy and anti-Parkinson's disease drugs. So, if you're on any of these medications and you feel that they may be aggravating your constipation, then I would suggest going and talking to your GP and seeing what the possibilities are. The other area that's non dietary is incorrect toilet positioning. So here is a picture of the ideal toilet positioning where you're leaning slightly forward and you're using a footrest. That gets you much more into a squatting type position, which makes it much easier for the stools to come out. People who have sudden changes in their daily routine will often find that their stools change as well. Now, that change in routine could mean that you're actually holding your stools longer than you should. You're not responding to that urge to pass a stool. This is particularly the case for a lot of women who don't like pooing outside of their home toilet, and they don't like pooing at work or in public loos. So they end up holding their poo. And the trouble with holding the poo is it can start that cycle of constipation, because if you ignore that urge to move your bowels and you regularly do that, you may stop feeling the urge, and then this will lead to constipation. So try whenever possible to act on your urge to pass a stool. Now, obviously, that's not always going to be possible. You might be in the middle of the cinema watching a film, or you might be out to dinner with friends, or there are always going to be situations where it's not possible. But as far as is possible, try and follow that urge to pass a stool. So, what about diet and constipation? Let's look with a magnifying glass at that and see what we can find out. I'm sure most people with constipation have already been told that fiber is very important. Now, the guidelines for fiber are to have 20 to 30 grams of fiber a day. And most of the population in the UK don't reach that. They certainly don't reach 30 grams. And it's something we really need to work towards. Most people will reach that if they have two whole grains, two to three sets of whole grains. So, for instance, oats for breakfast, as in porridge, and maybe brown rice at dinner. Um, Adding things like legumes, beans, lentils, etc., will help. And eating fruit and vegetable of some description at every meal is really important. And then small amounts of nuts and seeds daily is really helpful too. So seeded bread, or putting a handful of pumpkin seeds and sunflower seeds on your porridge in the morning, for instance, or throwing nuts and seeds into a salad. There are simple ways that you can very quickly increase your fiber. So there are two different types of fiber. There's soluble fiber that's found in foods like oats and fruit and vegetables and beans and pulses. Now, this soluble fiber forms a gel like material that helps your stools move through the bowel. And then there's the insoluble fiber, and this is found in whole grains and fruits and vegetable skins and nuts and seeds. And this fiber remains intact, and you'll have often seen parts of what you're eating come through in your poo. The classic one is sweet corn, for instance. And that's because it's got a lot of insoluble fiber. So it doesn't break down very efficiently, remains intact, but it helps to lead to bulkier stools that are more efficiently passed through the bowel. So, fruit and vegetable, we're looking at having 5 portions of a variety of fruit and vegetables every day. And a portion of fruit and vegetables is about 80 grams. So, if you had sort of 80 grams of tomato, that would be a portion of vegetable. Nuts and seeds, eaten on their own, or they can be added to cereals and snacks, as I mentioned just now. Legumes like lentils, black beans, baked beans, broad beans, kidney beans, soya beans, chickpeas, all of these could be thrown into casseroles and stews and made as separate dishes. So, really useful to have these added to your diet, and they'll definitely help the movement of your bowels. And then the whole grains like whole wheat bread, whole wheat pasta, jumbo oats. I always think it's much better to get the big oats. Oat bran, whole grain spelt, brown rice. Brown rice is fantastic because not only has it got more fiber, it's got a lot more nutrition in it than white rice. Everything in the white rice has been stripped out so that it's nice and white and clean looking. Brown rice actually tastes almost identical to white rice, but has a lot more nutrition. Takes slightly longer to cook, but it's worth it. Very, very good. And then whole grain breakfast cereals. But with this, make sure you're drinking sufficient fluid. You need to be having at least 1.5 to 2 litres of non caffeinated fluid a day, because if you increase your fibre, and particularly if you increase it too quickly, it can actually make constipation worse. So one of the things that will help that is to make sure you've got enough fluid in your diet. So as I said, introduce fiber gradually over weeks rather than days to minimize the side effects and to minimize the gas and bloating and abdominal cramps that some people may get from suddenly increasing their fiber. But the new papers or the new guidelines that I spoke about at the very beginning of this webinar give us evidence for specific foods rather than just generalizing about fiber. And one of the really important areas was psyllium husk, and this came out very strongly in both sets of guidelines. And when taken with water, psyllium husk swells and it adds bulk and it stimulates those bowel contractions, increasing the frequency of your stools and softening the stools. Although it might increase wind a little bit, but generally speaking, it's extremely efficient and it came out as a very important addition to the diet if you suffer with constipation. The other interesting one is over the last few years, there's been a lot of research into kiwi fruit, and they contain an enzyme called actinidin. And this helps increase stool frequency and reduce abdominal pain. To get this effect, you need roughly 2 to 3 kiwi a day, and it can be gold or green kiwi, it doesn't really matter. But you need 2 or 3 a day to have that effect. But it's a really nice, simple way of adding extra sort of natural laxative to your diet. And you can cut a kiwi in half and scoop it out with a spoon a bit like a boiled egg, or you could chop them up and put them into onto your porridge or fruit salads, etc., or have as pudding. So there's lots of ways of eating your kiwi, and they are very good. The evidence is increasingly supportive of kiwi for constipation. Prunes, that's our classic go-to for constipation. Prune juice or prunes have been used for many years to help constipation. But when they looked at the evidence for them, they were no better than using psyllium husk. But prunes can cause wind and bloating and abdominal pain, sort of IBS type symptoms. So for people with IBS, you may find psyllium is more effective. Rye bread came out as it can increase bowel movements but may worsen overall constipation symptoms and can cause some stomach discomfort initially. So it wouldn't be my number one go to. But if you're not having success with other areas that we've been discussing, then it may be worth trying rye bread. But increasing fiber, if you have a history of blocked intestines or a physical condition that makes passing stools difficult, then don't increase your fiber and get medical advice before you make any changes to your diet. Fluid is incredibly important. And I mentioned it briefly earlier with whole grains. So, fiber and fluid, if you increase fluid alongside fiber, that's the best method when you're increasing your fiber. Adequate fluid helps to soften the stools and ease those bowel movements. Fluid plus fiber may also help to actually reduce bloating. So, that could be really useful for some people. And we're looking, as I mentioned earlier, at having about 1.5 to 2 litres of non-caffeinated fluid a day. So that doesn't include caffeinated coffee and tea in that quantity. But it could be still or sparkling water or diluted cordial or herbal teas. And you could even take fresh mint or fresh ginger and lemon and chuck it in the bottom of a mug and pour boiling water on. You've got a fantastic herbal tea, which will count towards your 1.5 to 2 litres a day. Alcohol, excess alcohol, a little bit of alcohol is not a problem, but excess alcohol can cause dehydration, and that will reduce the access to fluid for your bowels. So it will mean that you've got less fluid mixing with your stools, and that will lead to hard, difficult to pass stools. So you do need to be conscious of alcohol in excess. Interestingly, the evidence is showing that excessive caffeine from coffee and tea may be associated with constipation, although the research really can't work out why yet. So we don't know why, but when they look at the studies, they see that excess caffeine does seem to be linked. So I'm sure more research will come out about the whys in the future, but at the moment we don't. It's not really well understood. So, what is the evidence for specific fluid? And this is a really interesting area and quite easy to do, and I think is just a great simple change to make. And this is using mineral water that is rich in magnesium sulfate. Now, we're really talking about sparkling mineral water, and you need one that's got a high magnesium sulfate content. Now, San Pellegrino and Badwa both have a high magnesium sulfate content, but things like Buxton, etc., don't. So there's no point using that mineral water for this purpose unless it has the high magnesium sulfate. Nothing wrong with having those other mineral waters for pleasure, but if we're looking to get that anti-constipation effect, then having high magnesium sulfate is good. Now, I have been told by patients recently they found it very difficult to get Badwa in the UK, but it's readily available in Europe. So if you're on holiday in Europe, and San Pellegrino is readily available in all supermarkets in the UK. So if we summarize what we've learnt about diet so far, so use psyllium husks to soften the stools and increase bowel movements. Number one, eat 2 to 3 kiwi per day to increase stool frequency and reduce abdominal pain is number two. Number three, drink a litre a day of mineral water that is high in magnesium sulfate to help soften the stools and increase bowel movements. Number four, eat plenty of fibre, including fruit, vegetables, whole grains, nuts, seeds, legumes, and that will increase stool frequency and improve the consistency of your stools. Number five, drink a minimum of 1.5 to 2 litres of non-caffeinated fluid a day to soften your stools and make them easier to pass, which helps to reduce straining and discomfort. And the final point is avoid drinking excess alcohol or caffeine, as excess alcohol is definitely linked to dehydration, which can lead to hard and difficult to pass stools. So let's look at the evidence for specific supplements, because people often ask, should I take a magnesium supplement? Should I take probiotics, etc.? So let's look at magnesium oxide supplements first. And these are recommended by both the new sets of guidelines. So they can increase bowel movements and soften stools, helping to reduce straining. You start with a low dose, about half a gram, which is 500 milligrams a day, and increase this gradually as it's tolerated or as needed. A maximum dose would be 1,500 milligrams or 1.5 grams per day. Some people may experience abdominal discomfort or diarrhea. So, if you've got it up to a certain dose and you start getting these symptoms, then taper it back to a dose where you didn't get the discomfort and diarrhea. However, it's really important to note that this is not suitable for patients with kidney disease or other major diseases. So, you must check with your GP or medical team before you start taking magnesium if you've got other medical conditions. Now, what about probiotics? There is so much evidence coming out about probiotics at the moment, and there's still so much we don't know and don't understand. But with the research into constipation, there are three areas that are showing promise. Still lots of research needed to actually be able to recommend these, but so far these are the ones that look promising. So, Bifidobacterium lactis supplements may increase stool frequency but do not impact stool consistency. Multi-strain probiotics might help to soften stool consistency. And another one, Bacillus coagulans unique 1S2 supplements do not impact stool frequency or consistency, but may improve the frequency of abdominal pain. So the probiotics may help some people, but it remains unclear which types. And there is so much more research going on. So this is just the very early days of research into probiotics and constipation. The advice would be that there is a lack of convincing evidence to specifically recommend any probiotic strains for constipation. And probiotics, when we look at overall quality of life measurements for constipation, probiotics don't seem to make an awful lot of difference to people's quality of life when they've got constipation. However, the guidance says if a patient really does want to try them, then that's absolutely fine. Try them for 4 weeks, following the manufacturer's instructions, and see if it makes any difference. Laxative. So we've looked at diet, and we've looked at non-dietary causes, and we've looked at dietary causes, and we've looked at supplements. And I now want to touch on laxative because obviously they are a very important part of the treatment for constipation. And there are different types of laxative, all of which are mentioned in the new guidelines. So both equal top are osmotic agents and bulking agents. Osmotic agents work by drawing water from the rest of the body into the bowel, so that water can then mix with your stools and make the stool easier to pass. And the one that has the fewest side effects is polyethylene glycol, also known as PEG. That seems to have a very good results for people with constipation. Magnesium oxide, we've already touched on as one of the supplements, and lactulose comes under the osmotic agents as well. The trouble with lactulose is if you've got IBS, this can increase bloating and wind and abdominal pain. So we definitely wouldn't recommend it if you've already got gut symptoms, particularly IBS symptoms. So the polyethylene glycol, the PEG, is probably the best one for the osmotic agents. Bulking agents, these increase the bulk of your stools, helping them to retain the fluid and then encourage the bowels to push the stools through. And they work in the same way as dietary fiber. And the classic one there would be psyllium husk. Then you've got stimulant laxatives, but these are only used as second line or rescue therapy, and they're only for short term use. And they stimulate the nerves that control the muscles that line your digestive tract, and that speeds up the movement of the bowels. And that covers things like bisoconol, senna, and docusate. But they're definitely not for long term use. Finally, you've got stool softeners, and these increase the fluid content of hard, dry stools, making them easy to pass. And they generally are there to help people not to strain. So, people who've just had bowel surgery or just gone through childbirth, for instance, would be people that stool softeners might be suggested for. And that would be sort of Racosol or Docusate calcium as examples. Now, interestingly, senna, which is commonly used for constipation, when the British Dietetic Association guidelines came out, they said they looked into this really closely, and studies showed that it did not clearly improve symptoms of long term constipation. And therefore, based on current evidence, senna is not recommended for chronic constipation. So, laxatives. Generally, it's about the dose and the choice and the combination of laxatives. And it depends on your symptoms and the response you get to the different laxatives. Some people will have a lot of success with just one type of laxative. Other people will need a couple of laxatives, and they'll take them in different ways to try and help their constipation. And there are other laxatives as well, but they need to be prescribed by a gastroenterologist. Things like lignotide and precalopride, they're less commonly used and may have more side effects, so they need to be prescribed separately. So I often get a lot of people asking whether the advice for constipation differs if you've got a history of diverticular disease. And the answer is no. The dietary advice for diverticular disease has changed enormously over the last few years. And it's really important to highlight that you are no longer advised to avoid seeds, nuts, popcorn, or fruit skins. And actually, the complete reverse of the previous advice is that you should eat plenty of fiber, and that fiber actually reduces the risk of developing diverticular disease in the first place. A diet high in fruit and cereal actually reduces the risk of hospitalization with diverticular disease as well. So, fundamentally, if you've got diverticular disease, you should have an unrestricted diet. And even those with uncomplicated diverticulitis, where one of the diverticulars become infected, if it's uncomplicated, they're still advised to have an unrestricted diet with plenty of fiber. What about the people who've made all these changes? They've tried everything. And they'll say to me, my symptoms are no better. In fact, my symptoms are worse. What should I do? Well, the first thing I would say is take you back to that red flag chart that we looked at right at the beginning of this webinar. I want to make sure there isn't something else going on that's causing the constipation that hasn't been picked up yet. So, if you've got any of these symptoms that we discussed earlier, like blood in your stools, weight loss, low iron levels, a sudden change in symptoms. So, let's say you've historically always had very loose stools and suddenly you've got constipation, or the reverse. Waking at night regularly with your symptoms, stools that are black, and stomach pain when you pass a stool. If you've got any of those symptoms, then please go and see your GP. And if you've tried everything on the list for constipation and nothing's worked, I would still go and have a chat to your GP. But there are other treatments to be considered, and these might be what you would discuss with the GP, assuming you've got none of those red flags. So, pelvic floor dysfunction. This is where the muscles of the pelvic floor do not relax like they should do. And so it stops the passage of stools moving easily through. It feels like you need to pass a stool, but nothing's coming out. Now, this is often treated with biofeedback and retraining those pelvic floor muscles. And you would need to see a specialist pelvic floor physiotherapist or your local continence service who would give you advice on this. So that's one area that you might look into if everything else hasn't worked for your constipation. And the doctor might suggest other tests. They might suggest an x-ray to find out if there's a large amount of stool in your colon, so that impacted stool. And they might suggest a colonoscopy. And this test is to rule out cancer and diverticular disease and polyps, etc., in the colon. You'll be asked to eat a low fiber diet for 2 to 3 days and have a drink that will help completely clear out your bowels. And then the doctor will place a long, thin tube with a tiny camera into your rectum and intestine so that they can see inside your colon. So that might be a test that you're referred for. Other tests your doctor might suggest would be a colonic transit time test to see if you feel your stools are moving very slowly through colon. You swallow a pill. It has about 24 pellets or markers, and these end up scattered in your colon. And after a few days, an X-ray is used to see how many pellets there are still in your colon, and that will give them an idea of how quickly or slowly your colon moves stools through it. And the last one would be anorectal motility study. This tends to be used if you strain a lot or you feel unsatisfied after passing a stool. And a small tube is placed in the rectum and you contract and relax the muscles while data is collected on how those muscles work. And sometimes you're also asked to push out a balloon from the rectum to test the muscle action. So those are tests that you might be referred for if you've done everything else for constipation, it hasn't worked. But for the majority of patients suffering with constipation, the advice is simple. Use a combination approach. Use those lifestyle changes that we mentioned at the beginning, the diet changes, and an effective laxative regime. And for most people, that will solve their problems with constipation. Now, the references I use today, so the new 2025 guidelines are both listed here, and the NICE guidelines, which is the UK guidelines for constipation adults, are also listed here. So if you want to read up further on the new guidelines or what's advised, then please feel free to access any of those papers, and you'll find them on the internet. And thank you very much for listening. And I hope that you find this helpful. Please don't hesitate to rewatch it because it's quite difficult to take all that information in one session. So, you can always speed through it or rewind to certain bits, whatever you feel is appropriate for you, and rewatch it as many times as you want. And I hope you find it useful. Thank you for listening. Goodbye.